Hello everyone, welcome back to my channel. When you want to simplify medical concept for your exam, and if you are a medical student preparing for exit or COC exam, you are in the right place. Don't forget to subscribe my channel for access related video. This is obstetric and gynecology exam question number 1. A woman with pregnancy-induced hypertension, vaginal bleeding, cocaine use, and late distillation likely has A. Placenta previa, B. Vasa previa, C. Placenta abruption, D. Uterine rupture. The correct answer is C. Why? Placenta abruption is associated with hypertension, smoking, cocaine use, and painful vaginal bleeding with fetal distress, what we call it late deceleration. This is most likely associated with placenta abruption. So the correct answer is C. The next question: a laboring mother progressing from 5 cm to 7 cm in 4 hours duration. So what is the most likely diagnosis? A. Normal labor progression, B. Protracted cervical dilatation, C. Precipitate labor, D. Arrest of labor. Think over it for 5 seconds. The correct answer is B. Because in the case of protracted labor, is diagnosed if cervical dilatation is less than 1.2 cm per hour in nulliparous women, or if it is less than 1.5 cm per hour in multiparous women. So within 4 hours there is the advance of cervical dilatation from 5 cm to 7 cm, only 2 cm is progressed. So this is the protracted cervical dilatation. The next question, the next question, the management of protracted cervical dilatation based on the above. A. Augmentation of oxytocin, B. Cesarean section immediately, C. Manual dilatation, D. No intervention. Please try to get the answer within 5 seconds. The correct answer is A. The correct answer is A, because oxytocin enhances the uterine contraction to speed up the labor if there is no contraindication. If there is no contraindication, you can augment with oxytocin. The next question: a woman at 30 weeks present with no fetal movement for 5 days duration, and the ultrasound confirms absence of fetal health activities. So what is the most likely diagnosis? A. Missed abortion, B. Fetal demise, C. Treating abortion, D. Inevitable abortion. The correct answer is B, because fetal demise or IFD is the intrauterine fetal death after 28 weeks of gestation there's no fetal health activities. But in according to WHO, it is after 20 weeks of gestation, what you call it, fetal demise. But in our context is in Ethiopia, after 28 weeks of gestation, what we call it, fetal demise. The next question: an 18 years old with severe menstrual pain since menarche, nausea and headache likely has A. secondary dysmenorrhea, B. Primary dysmenorrhea, C. Endometriosis, D. Pelvic inflammatory disease. The correct answer is B. Because primary dysmenorrhea is a painful menses without any pelvic pathology. It is maybe often due to access of propagandist, the access of the propagandist. Maybe this is the correct answer is B. The next question. To prevent breast engorgement, the nurse advises A. Feeding the neonate every 5 minutes, B. Wearing a nipple shield, C. Breastfeeding frequently, D. Decreasing fluid intake. The correct answer is C. Because frequent breastfeeding prevents milk stasis or engorgement of the breast. The engorgement of the breast. So the correct answer is C. The next question. A neonate startled or feared by noise extends arm and cries. This reflex is A. Startle reflex, B. Babinsk reflex, C. Grasping reflex, D. Tonic neck reflex. The correct answer is A. Startle reflex or Moro reflex is a normal neonate response when the baby is startled or frightened by the noise. So the answer is A. Question number 8. A pregnant woman with lower back pain should A. Perform Taylor sitting, B. Do leg lift, C. Circle the shoulders, D. Squats. Think over it for 5 seconds. The correct answer is A. The Taylor sitting is straightening the pelvic muscles, which is very important for relief of back pain during pregnancy, especially during pregnancy. When we say Taylor sitting is the sitting on the floor and bend one leg and crossing over the other leg. What we call it Taylor sitting. So this is very important to relieve back pain during pregnancy. So the correct answer is A. The next question, the nurse sees 2 cm bright red stain or circumcision sites. The first action is A. Notify the pediatrician, B. Recheck in 30 minutes, C. Secure the diaper tightly, D. Apply gentle pressure with sterile gauze. Think over it for 5 seconds. The correct answer is D. Because gentle pressure stop the minor bleeding. The minor bleeding is the brown red is so minor bleeding. Apply gentle pressure is very important for stopping that bleeding. So the correct answer is D. Question number 10. A pregnant client with abruption placenta will likely have A. Excessive vaginal bleeding, B. Rigid board-like abdomen, C. Tetanic uterine contraction, D. Premature rupture of membrane. The correct answer is B. A rigid abdomen indicates the counselled hemorrhage in the abdomen. This shows there is abruption of the placenta. So the correct answer is B. Question number 11. What is the most common cause of postpartum hemorrhage? A. Retained placenta, B. Uterine atony, C. Uterine rupture, D. Coagulopathy. Think over it for 5 seconds. The correct answer is B. Because uterine atony or failure of uterus to contract after delivery is the most common cause of postpartum hemorrhage, which is leading to excessive bleeding. So the answer is B. The next question. A woman presents with fever, foul-smelling nausea, uterine tenderness, and tachycardia on postpartum day 3. So what is the most likely diagnosis? A. Endometritis, B. Mastitis, C. Urinary tract infection, D. Retained placenta. Retained placenta. Think of it for 5 seconds. The correct answer is A. The postpartum endometritis is a polymicrobial infection uterine lining. Common after cesarean section. And also it's present with fever, foul-smelling nausea, and uterine tenderness. So if this sign present with the postpartum woman, the most likely diagnosis is endometritis. The next question. Which drug is contraindicated in postpartum hemorrhage in hypertensive patients? A. Oxytocin, B. Misoprostol, C. Carboprost or Hemabate, D. Methyl-ergonovin or Metergine. What we call it in other name is ergometry. Think of it for 5 seconds. The correct answer is D. Because in the case of hypertensive patient, the ergometrin is cause the vasoconstriction, which can exacerbate hypertension. This results in the related factors The next question. The most effective way to prevent neural tube defect is A. High protein diet in pregnancy, B. Vitamin D supplementation, C. Daily folic acid before conception, D. Early ultrasound screening. Think over it for 5 seconds. The correct answer is C. The folic acid supplementation before conception reduces neural tube defect like spinal bifida and anencephalus. So the correct answer is C. The next question. A 38 weeks pregnant woman has painless vaginal bleeding. What is the most likely diagnosis? This is an easy question. A. Placenta previa, B. Placenta abruption, C. Uterine rupture, D. cervical cancer. Think over it for 5 seconds. The correct answer is A, because placenta previa presents with painless bright red vaginal bleeding in third trimester, which is requiring cesarean section delivery. Okay, the next question. A multipara woman at 8 cm cervical dilatation and 100% of cervical investment and 0 station in the case of A, active phase, B, latent phase, C, expulsive phase, D, transition phase. The correct answer is D. In the transition phase, from 8 to 10 cm is the final part of active labor. So the correct answer is D. The next question. A neonatal head molding depends on A, fetal body flexion and extension, B, maternal age and weight, C, ethnic background, D, parent and gravidity. Okay, the correct answer is A, because molding results from fetal head positioning rather than maternal age, weight, ethnic background, or parent or gravity, though the fetal head body flexion and extension determine the neonatal head molding or not. The next question. Before applying internal fetal monitoring, the nurses or midwife ensure that A, rupture of membrane, B, zero station of the fetus, C, full cervical dilatation, D, administration of anesthesia. The correct answer is A, because internal monitoring requires ruptured membranes. After that, you can go to the other steps. The next question. A progestin only oral contraceptive increase the risks of A, endometriosis, B, female hypogonadism, C, premenstrual syndrome, D, tubal or ectopic pregnancy. The correct answer is D. Why? Progestin only pill alters tubal motility. This results in increasing ectopic pregnancy risk. So the correct answer is D. The next question, cervical investment and dilatation are not progressing in a patient in labor, and the doctor order IV administration of oxytocin. Why should the midwife monitor the patient's fluid intake and output closely during oxytocin administration? A. Oxytocin causes water intoxication. B. Oxytocin causes excess stress. D. Oxytocin is toxic to the kidney. D. Oxytocin has a diuretic effect. Think over it for 10 seconds. So the correct answer is A, because oxytocin has an antidiuretic effect and can lead to water retention, causing water intoxication or hyponatremia. Which may result in seizure or coma death. That's the reason behind why the nurse or midwife monitors the patient's fluid intake and output closely during oxytocin administration. The next question. After administering betanicol to the patient with urine retention, the nurse or midwife monitors the patient for adverse effects. So, which is the most likely to occur? A. Decreased peristalsis. B. Increased heart rate. C. Dry mucosa membrane. D. Nausea and vomiting. The correct answer is D. Why? Beta-nicole is an cholinergic agonist that stimulates the parasympathetic nervous system, which leads to increased gastrointestinal motility, which can cause nausea and vomiting, diarrhea, and abdominal cramps. So this is the adverse effects of beta-nicole. The next question: a woman with suspected ectopic pregnancy has beta-HCG level of 1000 international units per liter, but no intrauterine pregnancy on ultrasound. So the next step is A. Repeat BCG, beta-HCG in 48 hours. B. Immediate method treatment. C. Immediate surgery. D. Magnetic resonance image pelvis. The correct answer is A. If beta-HCG is less than 1500 international units per liter, you should have to be repeat in 48 hours. If it fails to double, ectopic pregnancy is likely. So the correct answer is A. The next question, question number 22, in which condition is immediate cesarean section is indicated? Which condition? A. Brief presentation. B. Placenta previa with active bleeding. C. Prolonged labor. D. Mild preeclampsia. This is the question. The correct answer is B, because placenta previa with bleeding is obstetric emergency. It is requiring the immediate cesarean section, to prevent maternal and fetal hemorrhage. The next question: a woman at 36 weeks with severe preeclampsia should be managed by A. Expectant management. B. Immediate delivery. C. High dose of antihypertensive only. D. Magnesium sulfate alone. The correct answer is B. The severe preeclampsia after 34 weeks require immediate delivery to prevent eclampsia, complication. The next question: the most specific sign of uterine rupture is A. Severe abdominal pain. B. Sudden loss of fetal station. C. Vaginal bleeding. D. Hypotension. The correct answer is B. Sudden loss of fetal station or the fetal head retracting upward is a classic sign of uterine rupture, so which is an obstetric emergency. So the correct answer is B. The next question: the Bishop score is used to assess A. Risk of preterm labor. B. Induction of labor progress. C. Fetal distress. D. Uterine rupture risk. The correct answer is B. A Bishop score evaluates or assesses cervical favorability for labor induction. A high score, or if it is greater than 6, suggests higher chances of vaginal delivery, higher success rates. The next question: the midwife nurse is developing a teaching plan for a patient who is 8 weeks pregnant. The midwife nurse should tell the patient that she can expect to feel the fetus move at which time? A. Between 10 to 12 weeks of gestation. B. Between 16 to 20 weeks of gestation. C. Between 21 to 23 weeks of gestation. D. Between 24 to 26 weeks of gestation. The correct answer is B. This is a question, by the way. Quickening or first fetal movement is usually feel between 16 to 20 weeks, with multiparous women noticing earlier than gravida women. The next question, a patient in the second stage of labor. During this stage, how frequently should the midwife nurse in charge assess her uterine contraction? A. Every 5 minutes. B. Every 15 minutes. C. Every 30 minutes. D. Every 60 minutes. Why? The second stage of labor involves active pushing. This result is frequent monitoring, or what we call it every 5 minutes, ensure fetal well-being and labor progression. The next question, a client at 40 weeks of gestation has enlarged uterus approximating 18-20 weeks pregnancy. The doctor suspects gestational trophoblastic disease. So what will ultrasonography most likely reveal? A. An empty gestational sac. B. Grape-like clusters. C. A severely malformed fetus. D. An extrauterine pregnancy. The correct answer is B. Because the gestational trophoblastic disease or molar pregnancy is characterized by hydropic villi, which is appearing as a grape-like cluster or ultrasound. So the answer is B. The next question. After second vaginal examination, the nurse midwife determines that the fetus in the right occipital position at -1 station. So where is the fetal presenting part? A. 1 cm below the ischial spine. B. Directly in line with ischial spine. C. 1 cm above ischial spine. D. In no relationship to ischial spine. The correct answer is C. Because a station of 1 cm minus 1 cm means the fetal head is 1 cm above the ischial spine, which is indicating the fetus is not yet fully engaged in the pelvis. Because the ischial spine is the referencing point for the fetal head position, fetal head station. The next question, what is the global prevalence of anemia among women in low and middle income countries? A. 50%, B. 10%, C. 30%, D. 70%. The correct answer is C. Anemia is a common health issue among women in low and middle income countries, primarily due to iron deficiency. According to the Global Health Report, around 30% of women in low-middle income countries suffer from anemia, which is impacting the maternal health and the birthing outcomes of the pregnant woman. The next question, for normal weight women, how many additional calories should be consumed per day during pregnancy? A. 500 to 700 kilocalories per day. B. 1000 to 1200. C. 350 to 450 kilocalories per day. D, 150 to 350 kilocalories per day. The answer is C. During pregnancy, energy need increase to support fetal growth and maternal physiological change. For women with normal pregnancy, the body mass index is an additional 350 to 450 kilocalories per day is recommended, particularly in the second and third trimesters. And excessive calorie intake can lead to excessive weight gain, while inadequate intake may increase risks of fetal growth restriction. So, the balanced, not increase, not decrease. So the correct one is 350 to 450. If it is excessive, it can lead to excessive weight gain, and if it is decreased or inadequate, intake may increase the risks of fetal growth restriction. So the correct one is this one. The next question: what is the recommended amounts of weight gain during pregnancy for women with a normal pre-pregnancy body mass index 18.5 to 24.9? A, 25 to 35 pounds, B, 40 to 45 pounds, C, 50 to 20 pounds, D, 30 to 40 pounds. The correct answer is A. According to the Institution of Medicine guideline, women with a normal body mass should gain 25 to 35 pounds, or 11.5 to 16 kilogram during pregnancy. This weight ensures proper fetal development while minimizing the risks of complications such as gestational diabetes and hypertension. The next question: daily supplementation containing 30 to 60 mg of elemental iron and 0.4 mg of folic acid is recommended by World Health Organization to prevent all of the following except low body mass index, B, anemia, C, preputial sepsis, D, low birth weight. The correct answer is A. In the World Health Organization recommends daily supplementation of 30 to 60 mg of elemental iron and 0.5 mg of folic acid. It prevents anemia or iron deficiency is a major cause of maternal anemia and puerperal sepsis. Iron support immune function and reducing the postpartum infection. And also, this iron is decrease low birth weight by what? Helping fetal development. However, supplementation doesn't directly prevent low body mass index in pregnant women, which is influenced by multiple factors including diet, metabolism, and overall health. So it is not directly to prevent low body mass index, but the rest one is prevented by folic acid and irons. The next question: which vaccine is contraindicated in the pregnancy? A, tetanus toxoid, B, influenza, C, rubella, D, hepatitis B. The correct answer is C. Live vaccine like measles, mumps and rubella, varicella and BCG are contraindicated in pregnancy due to the risks of fetal infection because it is a live vaccine. So it is not recommended in the pregnancies. The next question. The best way to confirm premature rupture of membrane is A. Vaginal exam, B. Nitrogen and fan test, C. Fetal heart rate monitoring, D. Abdominal ultrasound. The correct answer is B. Nitrogen and fan tests. Nitrogen paper test or pH test and fan test is a microscope confirming the amniotic fluid leakage in the prom. The best way to confirm premature rupture of membrane is nitrogen and fan tests. The best one is the fan test. The next question. The most common cause of non-immune hydrops fetalis is A. RH incompatibility, B. Congenital heart defect, C. Parvovirus B19 infection, C. Twin transfusion syndrome. The correct answer is B. Congenital heart disease like hypoplastic left heart cause heart failure, which is leads to hydrop fetalis or fetal fluid overload. The next question. The most sensitive test for diagnosing gestational diabetes is A. Fasting blood glucose, B. 1 hour glucose challenge test, C. Urine glucose test, D. Hemoglobin A1C. The correct answer is B. The 1 hour glucose challenge test is the screening test for gestational diabetes. If abnormal, a 3 hour oral glucose tolerance test confirms the diagnosis of gestational diabetes. The next question. Which fetal heart rate pattern is most concerning? A. Early deceleration, B. Variable deceleration, C. Late deceleration, D. Acceleration. The correct answer is late deceleration. Late deceleration indicating a uteroplacental insufficient leading to fetal hypoxia. It is require immediate intervention. But also there is also variable deceleration. Somewhat the best one is fetal heart rate pattern. Most concerning is late deceleration with the fetal heart patterns. The variable deceleration leading related with cord compression. So almost B and C is the correct answers. Thanks for watching. Have a nice time. Thank you.